tear of the liver tissue, there will be bleeding which is be occurring within the abdominal cavity. This type of bleeding or this type of hemorrhage is called an internal hemorrhage, or it is concealed hemorrhage. Sometimes there will be ulcers within your intestinal cavity. So what will happen is they tend to rupture it because of the passage of the food or any other untoward incident. So whenever there is rupture of intestinal ulcer wound, what will happen? They tend to bleed within the intestine. So this type of intestine. Whenever there is, for example, whenever there is any tumor or any unknown mass present in your upper respiratory tract or lower respiratory tract, so there will be rupture of your tracheal walls or tracheal windpipe or rupture of your upper esophageal walls. So there will be tend to bleeding within the esophagus or bleeding within the trachea. So what will happen is they tend to expel this excess bleeding out through coughing. So whenever the person is expelling out the blood through coughing, then it is called as hematemesis. Hematemesis. Then the term is called as hematemesis. So whenever the blood is coming through stools, it is called as melena, because the terminology used is called as melena, MELAENA, melena. So whenever it is coming through upper respiratory tract or upper GI tract, it's called as hematemesis through coughing, okay, or vomiting. Okay, whenever it is coming through the lower GI tract, it is called as melena. Okay, that is about your internal healing. So when it comes external bleeding, escaping through the skin, it is visible outside. You can see this bleeding actually. So that is called as external bleeding. Spontaneous bleeding. So the one which is happening without any untoward incident. This is especially seen in hereditary disorders, blood disorders like your thrombocytopenic purpures, okay, or your hemophiliac patients. They tend to the superficial or blood vessels or capillaries, they tend to very fragile and they tend to rupture into mild activity, and that you can see bleeding especially coming through the skin without any provocation. So this type of bleeding is called as spontaneous bleeding. Okay, this classification holds good when you try to explain the bleeding, whether in terms of whether it is visible or visible, or whether it is concealed, or whether it is happening because of untoward incident, without any untoward incident. Okay, remember this. So there are some particular terminology which you commonly use whenever you are describing a particular type of hemorrhage, where it is happening and how it is happening. So when hemorrhage occurs because of any accumulation within the tissue, for example, hemorrhage within your salivary gland, hemorrhage within your liver, or hemorrhage within your tissue space, then the terminology used is called as hematoma. Hematoma. Oma means tissue space. Hema means blood. So tissue space is occupied by the blood. Then you have to use the terminology called as hematoma. Okay. Remember, as a medical or dental fraternity, when you are describing any case or any incident which is happening to the patient to any other medical professional, you need to talk in these terminologies, not in your layman terminologies. Okay. So whenever there is collection of blood within the tissue spaces, then you have to use the terminology called as hematoma. Okay, so there is another term called as petechiae. So this is very familiar to you. You have learned regarding blood disorders in your pathology as well as in your physiology aspect. So minute, that is about 1 to 2 mm of hemorrhage into the skin or mucous membrane. Okay, so you will see minute red spots, which is of 1 to 2 mm in size. There are multiple in it and vast, multiple widespread hemorrhagic spots, which is of size 1